Around the world, with only a month before the new school year starts, parents in the US are growing increasingly concerned over how to protect their children against the virus. And for more, we're now joined by Dina Gusowski from our studio in Washington, D.C. Dina, hello to you. So what can you say?
Just when we thought summer was around the corner, now school season is rapidly approaching in the United States, and people are concerned about more outbreaks of the H1N1 virus, also known as swine flu. Now, this virus targets children and young adults, so officials across the board are concerned about what's going to happen when students go back to school. They're in those close quarters, the classrooms, the dormitories. So the question is, what can we do as a precaution? Well, we get vaccinated for the regular flu, so why not the swine flu? But there's a group of people who question how necessary these vaccines are and if they are even safe. The National Vaccine Information Center is calling on Barack Obama and state governments to provide concrete evidence that it's absolutely essential for children to get vaccinated. Barbara Lowe-Fisher is the co-founder and president of the center, and she joins me today. Thank you so much for being here. Now, you seem to think that this whole swine flu issue is blown out of proportion, that people who get sick have the same symptoms as the flu, and they recover. Almost all of the people recover completely. If that's so, then who is it that's causing all this commotion? Is it the government? Is it pharmaceutical companies?
Well, there have been about 353 deaths that have been associated with this swine flu in the United States. About 43,000 confirmed cases, about 5,000 hospitalizations. If you look at the regular influenza that goes around every year, the symptoms that are associated with this swine flu are no more serious than the regular flu. So we're questioning why there is a national public health emergency that's been declared, why they're planning to vaccinate children in the school setting. We've never done that since the polio vaccine campaigns. We're very concerned that there are not safety mechanisms in the schools for giving parents information before vaccination, recording the manufacturer's name and lot number in medical records, monitoring the children for adverse reactions. There's just not a mechanism in schools, and that's why we're very concerned about this school-based vaccine program.
Well, it's interesting because officials, not just here in the U.S., but really all over the world, say that these vaccines are going to do more good than harm. They're saying that even if one child gets sick, it's going to save hundreds, if not thousands of lives. So how do you respond to that?
Well, you know, there's no evidence that this swine flu virus has mutated. It is stable right now. Again, it's not causing any more serious symptoms than the regular flu. I don't think that the reaction of the U.S. government matches what the actual situation is. We know that vaccines can cause injury and death, that some children are at higher risk, or individuals are at higher risk than others for having problems with vaccination. These swine flu vaccines are only going to be tested for a couple of weeks on a couple of hundred healthy adults and children. There are a lot of children in schools today that have chronic conditions.
And some people say that's even caused by the vaccines, like autism. There's a group of people who say that. But Let me ask you this. There's an act called the Emergency Use Authorization Act, which basically says that if a public health emergency is declared, then drug companies and officials don't really have to be held accountable if something does happen. One of the questions that your organization asks is, are these companies willing to provide financial and other support to children if they do get sick? So should we assume then that the answer is no?
We are very concerned about federal legislation that's been passed since 9/11 in this country that does allow, under an emergency use authorization, companies to fast-track experimental vaccines and drugs that are used whenever a public health emergency is declared. We're concerned about adjuvants that have never been licensed in this country being put in under the emergency use authorization, adjuvants that can cause autoimmunity and other chronic health problems. So yes, and then no liability is attached. No liability is attached for the vaccine manufacturers or anyone who provides the vaccines whenever these vaccines are used under the emergency use authorization. We are very concerned.
Okay, well, just one last question very quickly. We had talked to you before this, and we said, do you know of any other experts, scientists, doctors that may be able to comment on swine flu? And you said it's becoming dangerous for scientists and doctors who are questioning this vaccine to speak out publicly against it. Why do you think this is? And wouldn't that do so much harm if the very people who create these things can't even express their true opinions?
I have been a vaccine safety advocate for about 30 years, and I have watched, unfortunately, that when doctors or scientists step out and speak up publicly about vaccine risks, again, encouraging safer vaccine policies. They are ruined professionally. They are harassed.
Who's ruining them?
Well, there is this reluctance by the government and by medical organizations and by others who are very involved in promoting mass vaccine use to allow anyone from the profession to criticize. So that's left to those of us who are vaccine safety advocates to do that. So there are only a few doctors around the world who are stepping out and talking about the potential risks of swine flu vaccine and whether or not this is a true public health emergency.
Well, very interesting there. Thank you so much for your insight. This is an issue that's not going away anytime soon, and we will keep you posted of all the latest from here.